Welcome into this week's Degrees of Science. This year there have been 700 cases of measles reported across the United States and at least 2 confirmed deaths from this very contagious virus. All this even though the virus was declared eliminated in the United States in 2000. Today we're going to take a little deeper dive into measles. Today we're talking with Dr. Jana Shaw. She's a professor of pediatrics and public health and preventative medicine at the SUNY Upstate Medical University in New York. So Dr. Shaw, I guess right off the bat, what are the symptoms of measles?
Measles is a contagious respiratory virus, and the symptoms commonly look just like cold: runny nose, cough, congestion, high fever. But then the characteristic rash appears. It starts at the hairline and it spreads down through the body. For some children, that's how it ends. But unfortunately, we know 1 out of 4 children will end up in the hospital with complications. So for some of them, it may mean pneumonia, dehydration, and for some children, they may go on developing a serious brain infection and swelling.
Why are we so worried about this particular virus and this outbreak?
We are worried because we know that these numbers are probably under counts. We know that there were at least 2 confirmed cases of death already, and another 1 death is being investigated in an adult. And as such, it's likely that there are actually more cases than what we have accounted for, because typically for measles, 1 to 3 people per 1,000 will die of this virus. Since only 700 plus cases have been reported, it's likely that there are a lot more cases there. And those are probably cases that are maybe milder. People may not be seeking healthcare attention. They may not get tested. And as such, they go undercounted.
How contagious is measles? Does it spread really quickly?
It's one of the most contagious viruses we have. We know that probably 9 out of 10 people who are not immune to this infection will get infected. So it infects all those who are not immune. It spreads very easily through air. In fact, the virus can linger in the air for 2 hours, even if a person who was infected left the room. So it's a virus that will find you if you're not immune. Unfortunately, as we see declining vaccination rates, the number of populations or individuals at risk for the infection is increasing.
So do people that are contagious with this, are they already showing symptoms, or can they be contagious and spread this before you see any visible symptoms?
Unfortunately, people may be infected, not know about it, because they may not have all the characteristic symptoms. And in fact, people are contagious 4 days before the characteristic rash appears and for 4 days after the rash appeared. It's one of those viruses where people may be unknowingly infected, or even if they saw a healthcare provider who thought maybe the child just had a cold, will not properly diagnose the child, and as such, those people will go on transmitting the infection to others.
So this virus was declared eliminated back in 2000 in the United States. So what's causing these kind of periodic outbreaks? We've had one in 2014, one in 2019, and then this one that's going on now.
Essentially, we've seen a decline in vaccine confidence, and a larger number of children are under-vaccinated or not vaccinated at all. When you look at the outbreaks, whether it's the current at 2025, majority of the people who are infected are people who are not vaccinated or their vaccination status is unknown. The same situation occurred in 2019 when majority, 9 out of 10 people who were infected with measles virus were either not vaccinated or did not know their vaccination status. So what that tells you is it's the under-vaccinated or unvaccinated people who become victims of this virus and will go on spreading it to those around them.
So how effective and safe is the measles, mumps, rubella, the MMR vaccine that is out for this?
The vaccine is very safe. We know it's very safe because we have studied it in clinical trials, and we have also what's known as post-licensure vaccine safety monitoring in the US. It's a sophisticated system that monitors adverse events after vaccination on a large population level, so even very rare and uncommon complications can be detected. So the vaccination itself is a safer choice for parents because you don't know whether your child, when he or she gets infected, whether she will just have a mild case of measles or will go on developing a severe infection. So vaccination is always a safer choice. However, I should mention there are some local reactions that can occur with vaccination that are no different from other vaccines. Tenderness, pain, redness at the site of injection. Children may go on developing fever. So I would recommend, if parents have concerns about vaccine safety when it comes to MMR vaccine, that they talk to their healthcare provider to make sure that their concerns are addressed.
At what age should these kids be getting this vaccine, and is there multiple injections that they need to get?
The vaccine is recommended at 12 to 15 months of age for healthy children, and then before children go to school at 4 to 6 years of age. However, we have newer recommendations now, given the widespread of the virus, and if children are known to travel to communities with ongoing transmission, earlier vaccination can also be considered. So, for example, if your child is less than 1 year of age and you know you're traveling to a community where there is ongoing measles outbreak, talk to your healthcare provider whether your child can be vaccinated early to keep him or her safe.
So if you're a parent with a very young child, and like you were saying, this spreads without symptoms being even shown, what kind of precautions can parents of very young children do to try to keep their kids safe from this?
You know, outside vaccination, there's really not much you can do. Unlike what you may find on social media, we don't have other effective preventive tools to keep children safe from this virus. Vaccine works best, is safest. There are no other really medications you can take that will protect you from this virus. Vitamin A has previously been mentioned as something that parents can do to protect their children. Unfortunately, that's not true. We use vitamin A when children get hospitalized with measles, but it does not treat the infection, and it will not prevent infection in a child.
So with this as contagious as it is, I know there's been stories of clinics or hospitals having to close down because they're worried that there was a measles case in there. If you're a parent that has a kid that is showing symptoms, I know it compares to other ones as well, what should you do to try to, is it better to call the doctor or something to figure out if it's measles or potentially just something else?
I would recommend call your doctor first, because the last thing we would want is with a child who may have measles is to show up in urgent care or in pediatrician's office or in ER and spread the virus to others. So call your pediatrician or local health department and tell them your child has these symptoms, may be unvaccinated, you might have traveled to a high-risk area, and ask them what you should do. Typically, what we would recommend that you alert your pediatrician so the pediatrician can place you in a room directly and avoid you spending time in the waiting area to ensure that you won't transmit the virus to those around you. Similar to emergency room, you would want to alert the emergency room early on so they can take proper measures to ensure that you are brought to a room directly so you won't spread the virus to patients and staff around you.
So for those of us that were vaccinated when we were kids and now adults, are we covered in our entire life, or is there a need for a booster or something like this as you get older?
In general, the vaccination itself provides long-lasting immunity and protection. However, for people who might have been vaccinated before 1968, they should check with their healthcare provider to make sure they receive vaccine that will provide or have provided that protection for life. If you're someone who was vaccinated and might have had cancer or have received medications for rheumatological condition, essentially medications that will suppress your immune system, you might be at increased risk for measles due to the weakened immune system. And as such, it's important you reach out to your provider and ask them whether you would be a candidate for a booster, for additional dose of MMR to make sure you are safe.
Well, Dr. Shaw, some great information. Thank you for taking the time to talk with us today.
Thank you for talking to me.